I'm Glenn McGuinness, and welcome to Outburst. This week, opioid addiction in Canada.
It's gone a lot worse, and there's been a lot of political ineptitude.
How did it get so rampant in the first place?
I would say that there's not enough being done about it.
It's just too big for any one level to deal with alone.
Prescription opioids are safe. Nothing you buy anywhere else is safe. And people are going to be addicted to drugs no matter what we do. So let's just do it properly.
This common class of prescription has been causing enormous pain for police, policymakers, clinicians, and Canadians.
It started with codeine, T3s, turned into Percocets turned into hydromorphone turned into fentanyl, and fentanyl turned into heroin. So,
the National Day of Action.
Last year, nearly 4,000 people died from opioid-related causes in Canada. In 2016, that number was just over 3,000.
There is a person dying every 6 hours in BC of an opiate overdose.
It's something that's taken years and decades, in a sense, to have built to the crisis that we're facing now. Sadly, is not something that will be completely resolved overnight. But I absolutely believe that we can and must change this and find a way that people will not be dying every single day across our country as a result of overdoses.
Doctors have been increasingly prescribing opioids to treat chronic pain despite debate over its long-term effects. But experts at McMaster University and the Canadian Medical Association say this uptick may be due to aggressive marketing and clinicians wanting to be more proactive. Canada has the second highest opioid consumption rate in the world, behind the US.
This week, a new rule for those on the front lines. As of October 20th, warning stickers must be applied to some forms of opioid drugs, and a handout sheet is required for patients and families. But education and awareness is still an uphill battle. According to Statistics Canada, 77% of Canadians are aware of opioids. 51% would not recognize an overdose. 10% do not know the dangers of mixing opioids with other medications. And 7% of Canadians know how to obtain and use naloxone.
I think that all Canadians should know how to do this, because if you come across someone who is having a crisis, and it's more prevalent, from what I understand, in our younger members of society, especially in the Nova Scotia area, I think that them knowing this information would definitely be an asset for them helping other peers who may have an issue.
It depends, I guess, on how each individual feels about that, whether they feel comfortable kind of having that responsibility, but it would definitely be a good idea to have like the education and the tools available for anybody who wants to be able to help in situations like that.
I have some medical background, and I just think that the more people that know what to do in a situation like that, and it seems to be rampant in the high schools, so I think it would be a good thing.
I mean, kids are experimenting, you know how kids are, they can be kind of dumb. We're all kind of dumb as we're teenagers, you know. They might want to go to a party, see a white powder, think it's something other than it is, and then, you know, easily there could be an overdose, or you could be at a party where that could happen to a friend. It's extremely important, I think.
Maybe high school students, it's a bit young, but I mean, if high school students are using the drugs, then they should know how to potentially help one of their peers.
Well, obviously the opinion is that high school students shouldn't be required to deal with something like that, but it's simply providing the basic information to the high school students, because there are high school students using these products and overdosing on these products. I think that information is important for everybody to have.
Any kind of first aid that people can have is always beneficial.
We need people that are caring and, understands that people make mistakes, and, we can change. It's just they need to want to change. If they don't want to change, then there's not much we can do for them.
Yeah, I think that's something that's good to know. I know I got the training for it, and it doesn't take that long. It's like CPR, it's information is power, and it's something that can save someone's life.
Of course, there are emergency services such as 911, but as far as cops appearing at the scene, I don't think that should be a thing, because that generally scares people, and I don't think people want to be charged when it comes to an overdose. So it's an iffy situation, but if you ask me, I'd say the paramedics and maybe the firemen, but that's about it. I was just wondering about the precautions to take when somebody overdoses, because being a teenager in today's society, there's a lot of drugs going around, so it's kind of good to know those things.
Before I go to post-secondary school, I want to know all the risks and stuff about them before I jump right into partying and all that stuff.
I'm Jerome Sparks, and I teach Science 10 and Physics 11 and also Oceanography here at Harbor High School. The precautions about drugs and then what actually happens and the consequences of doing drugs is very important for our students nowadays, because a lot of students are in that phase that everything needs to be fun, so everything is talking about recreational, but we have to understand that a lot of stuff is physiologically and psychologically detrimental to some of the students' health.
A pharmacist will show you how to use a naloxone kit.
A lot of the drugs are usually prescribed, and so when you see prescription drugs, you probably think, oh, it's safe, you know, people aren't overdosing or people ain't overusing it. So I think by them having an awareness of some of the symptoms and some of the things to look out for in the trigger signs, I think it's just the knowledge is going to be key to them.
They're so addictive, and that's the issue. And we're not really aware of that when we're going through middle school and someone says, try this pill, and they pop in, next thing they know, they want to do it the next day and the next day and the next day and the next day.
If we know all the facts, when we have kids and all that stuff, we can teach them younger than we got taught this stuff, so they can grow up in a better life. I feel like parents should know a lot of these facts too before their kids jump into high school.
What questions do you have about opioids in Canada?
I do know that there's a lot of addiction, so why is the government making it potentially easier?
Why don't we legalize it?
Don't they have like a committee to stop this?
What services are available to help those who have addictions?
Well, why are doctors always prescribing pain meds that causes the addiction? Right? Yeah. My opinion.
Yeah. Okay.
Right? Doctors too free. I mean, there's other ways to treat people besides them addicting meds, eh?
When are we going to really be serious about funding harm reduction strategies?
Well, I'd like to know whether or not Canada is equipped to deal with an opioid crisis on the level that America is experiencing at this time.
Just how informed legislators are on the addictive qualities of different products and how bad the numbers really are for the addiction crisis that's going on in our country. I wonder if they know and what they're doing about it.
I don't really know much about what can be done for people with opioid addictions. Like, I don't know what's really being done, other than I know there's safe injection sites some places, but other than that, you know, if I had an opioid addiction, I don't think I would know where to go or how to get help, really. So I guess my question is, how would someone go about getting help?
How did it get to the point where it gets so easily into people's hands, and especially kids and adolescents' hands? So I would have liked to seen a bit more control around that, but that would be my biggest question, is how did it proliferate the way it did?
I'd just like to know how severe the problems are, I suppose, and what they look like in general, because I don't even know what opiates looks like.
I guess my questions are about getting more specific information about where the problems are, what demographics, what age group, what the actual problem is. We keep saying there's a problem, but where is the problem? Is it a problem with young people? Is it a problem with older people? Is it a problem with really well-off people? Is it a problem with poorer people? Where's the actual problem? What are the numbers?
There are simply so many people on the front lines of this crisis. This includes doctors, patients, police, policymakers, advocates, and addicts, who are all scrambling to find a strategy and a solution to this problem. Since 2016, prescription rates are down for the most common opioids in every province except for Newfoundland and Labrador. This includes codeine, hydromorphine, oxycodone, and fentanyl. But addictions, overdoses, and the sheer volume of illegal opioids on the streets remains a growing problem.
My name is Logan Carroll. I'm 25 years old and I was born and raised in Ottawa. My struggle with substance use started at a young age. I was about 12 years old when it started. I started using opiates by the age of 16. It started with a simple procedure. I went in to get my wisdom teeth taken out, and that escalated for the next 10 years. It started with codeine, T3s, turned into Percocets turned into hydromorphone turned into fentanyl, and fentanyl turned into heroin. So drug abuse and substance use disorder took over my personal life in a very difficult way. It started as something that was fun, it was social. When I started really heavily using, when I was roughly about 19, I became an IV user, and I was dating a girl, a really nice girl, that fell prey to my addiction, and I took advantage of her financially and otherwise. It was my first indicator that addiction had taken over my life in a way that nobody mattered other than me. I couldn't stop even if I wanted to. I was physically dependent on these drugs, and that's how I got through the day. That's how I coped. You know, I coped with my mental health by using drugs, and it worked for a long time, but at a certain point came along where it stopped working. So I came into recovery in October 2016, and I chose to try abstinence-based recovery, in which I used absolutely no drugs or alcohol whatsoever, and I was sober for about 10 months. And when I relapsed on a hybrid between heroin and fentanyl, synthetic fentanyl. I did about 0.2 of a gram, and I overdosed bad enough that I needed revival. I needed CPR for my girlfriend at the time. She called the ambulance. She gave me 2 Narcans, or naloxone kits, followed up by another 2 naloxone kits from the ambulance, and ended up in a per job. I was perfectly content living the life I was living at that point, because it seemed a lot more realistic to continue living that than to quit drugs in the first place, because my mind had got so twisted that I didn't think I could come back for it. It seemed easier to continue to live the life I was living than get better. But once I got a taste of recovery in 2016, I realized that I didn't need to live like that, and there was a much better way to live. What advice would I give somebody who's searching for help? For me, I had a hard time asking for help. I had a hard time admitting that there was an issue. If I was to say anything, it would be to reach out to somebody, start with somebody, talk about it with somebody. You know, a big part of what I do is connectivity. You know, get connected to the people around you, because there's people in the world that do love you, and it took me a long time to figure that out. So I was in Toronto in September, and there was a lot of ideas swirling around. A big one was decriminalization. They're looking to decriminalize all drugs like Portugal did. As far as I'm concerned, I don't think that's a solution that'll happen anytime soon. So for me, opiate-based replacement programs that they're introducing this year, I mean, Suboxone, Methadone, and there's a few others that are coming to light now. They give you a chance to see what your life would look like without drugs. You know, you get to experience life again and be a part of society, and get back and integrated back into the world.
They should be decriminalized in the sense that a user shouldn't go to jail for using drugs, but certainly if someone who is selling drugs and dealing drugs and making drugs, I think that should remain criminal.
That is what I think, but then they shouldn't help anyone who does not take responsibility for what they do either. Either you live by your choices or else.
No, I don't think that.
And why is that?
They're dangerous. A lot of things are dangerous, and they should be, I don't know, only given to people when they need them.
Just open it up, but have responsible areas, centers for addictive individuals, and try to be responsible as a society. But we could put our resources to much better use. I'm talking law enforcement without the drug factor. I say open it up, yes.
I'm not sure about all, but the ones where you have an epidemic where people are dying, I think that's a good indication that it's time to do something.
No, I don't think so. I think it would be too free and too easily available that I think it would be even worse than it is now.
Decriminalization is, of course, a nice goal.
And why do you think why do you think it would work?
Well, I'm from Holland, and that's where we sort of started with well, not I don't know what the word is, but it was not legalized, but it was sort of okay, and it helped a lot to prevent criminal activities. Just stupid things like stealing car radios and just to get money. It was no longer needed.
Holy smokes, would you want that open doors like, oh, there's a store and your kid when they're just... Because I remember when I was 18, like, in Manitoba here, drinking age, I can go out and, I can try it. That could be the same for drugs as well. Not for all kids, but I would argue probably a subset of extra kids that wouldn't be doing it today would go do it because it's legal, right? So what slippery slope does that create?
Criminalization really doesn't help the problem, I don't think. So there are probably better ways to deal with these issues.
No. Why? Because a lot of drugs have addicting traits, and I don't think it leads to very good outcomes. That's the main reason. And then there's also, I think there's reason to be scared of some drugs. Like I said, there's addictive traits from them. They lead to harmful situations, and I don't think that decriminalization would do good things.
Absolutely not.
Why?
Well, because I think there's just too many irresponsible people out there that would take advantage of that.
No. Actually, we're out here for an addictions conference. So we, for the Steincamp conference, so we work with drug and alcohol addictions in our community in London, Ontario. And I believe that there's a place for some decriminalization of certain recreational, if you'll call them, drugs. But there's other drugs that I think that we need to have make sure that there's a public understanding on just exactly how dangerous they are, and that there's a place for having them remain in a really restricted sense.
I'm wondering why we don't just legalize all drugs so that people aren't buying drugs from criminals. And I think, look what they've done in Portugal. It's been really good. There are other places where they've shown that decriminalize. Don't let criminals make money on people's misery.
So Portugal is the the model that people keep to refer to. So Portugal is different. First off, the police have a significant more power than we do here. There is treatment on demand. If a person's an addict, they are referred to all the social services that they can get to stop their cycle of addiction. And it's readily accepted. I think with all the differing political agendas, I think it would be a hard stretch in Canada. We are not a little country like Portugal. We're 5,000 miles across. I think that it would be an incredible task to be able to make it work. I would disagree with legalizing or decriminalizing anything more than what's already done. I think we risk a lot that we couldn't come back from. My name's Mark Steincamp. I'm a co-director of Understanding Fentanyl. I'm also a police officer in Vancouver. I've been a police officer for 27 years, but I don't speak as a police officer right now. I speak as a concerned citizen, and more importantly, I speak as a concerned parent. So we've seen hundreds of people die who are street entrenched. We've seen hundreds of people die who are recreational users. People have died on the street. People have died in their homes. People have died, they've gone to bed, and their parents or their loved one finds them dead in the morning. That is a significant impact on our society. Now, it's not just a British Columbia issue or a Canadian issue. This is going through the United States and the rest of the world like a freight train. So if British Columbia is the canary in the coal mine, get ready, because it's inevitable that what's happened in British Columbia will happen everywhere else. The documentary itself is broken into 3 modules. First one is about the drug itself. The second module is based on the impact.
It's taxing on the body physically. It's mentally draining, and now I'm going to get a call.
The impact is not just about emergency services providers, about the police and ambulance and firefighters. The impact is about families.
On August 2nd, Jack and his friend stopped on Commercial Drive to buy a pill. They split it in half. One half went to my son, and one half went to his friend.
Half of the tablet will result in a death of somebody, and their friend that took the other half of the tablet may survive.
And Jack died on the park bench at Shelley Park in Vancouver.
So this affects me as a parent in a ways that I never thought it would. But how could it not affect me in the way that it has? I have 2 sons, a 23-year-old and an 18-year-old. When it comes to drugs, educate your kids. I've been talking to my kids since they could walk. I share with them my genetic makeup, my family's genetic makeup, because some people say that that's an incredibly important part of whether you're going to go down that road to addiction. Talk to your kids about substance use and avoidance strategies. It's okay, you know, the old Nancy Reagan, just say no, N-O. You know what you need to do now? Have knowledge. Say K-N-O-W. Have knowledge about what's going into your body. Keep your kids active. Send them to bed tired. If you're a good role model, your kids are probably going to be okay.
British Columbia declared a public health emergency back in 2016. The province of British Columbia is alleging negligence and corruption against opioid manufacturers and is currently suing more than 40 pharmaceutical companies in hopes of reclaiming the costs of this opioid epidemic. Ontario has allocated $200 million for addiction treatment programs, and Alberta has a special committee overseeing a strategy on harm reduction, community awareness, and supervised consumption sites. Each province has a slightly different focus and many different opinions on how to tackle this issue. And now, it's your turn. How should government respond to the opioid epidemic?
I guess informing people, because it's happening. And if they're informing people, they can handle with those situations better.
It comes to regulating the medical community, not the governments or the people who are using it illegally. It's making sure that excess of this product isn't ending up on the streets. It's not the fault of the people that are using it. It's the fault of the people that regulate it.
They should have more treatment facilities. Maybe treat people like humans instead of like animals locked up in a cage. And I mean, if you look at somebody with an addiction, it's a choice that they made. This is a disease that they're going through, and if they want to get off it, they can get off it, but they need help. And a lot of people won't help people like that because they think they're just a lost cause, you know, and it's not right. We need more facilities. We need more money for like programs to help people get off the streets, get back into school, get jobs, get off drugs, various other things, you know. That we need a lot more of that stuff for sure.
Ban them. I mean, that's the easiest way.
Yeah, that's the biggest topic.
I think that they should have experts weigh in, and whatever they say, the government should follow.
Supplying what's needing, supply the training, and like I said, maybe they should be looking into the doctors. Maybe it should fall on them. You know, they should be the ones responsible.
Put more money into it for helping people out, and you know, these people are sick people. You got to help them when you can.
Legalization would be definitely a good start. Safe injection houses should be expanded at the very least.
More awareness, for one, I guess, that, you know, to be aware about it and to actually seek help, get people to come out and recognize that they need help.
I think this is a responsibility for everyone, but the government, if they just do some campaigns on it and they just try to enhance this.
Multi-pronged approach from reducing the supply of drugs that's coming into Canada, reducing the demand for the drugs in Canada, but also offering treatment to the people who are using drugs. There are various replacement strategies to use drugs that are safer than other drugs, than street drugs.
Well, they should be letting everyone know.
I think decriminalizing drugs would be the first step, and then looking into getting people help that need it through other avenues.
They should make sure that the doctors doesn't prescribe too much opioids.
Well, I think they need to legalize use, because making it illegal is not a solution. It actually increases use, so if we do that, then that's not helpful. I believe that we need more safe injection sites. And I believe as well that we need to really look at what kind of opiates are on the street. I haven't heard enough about where this fentanyl is coming from and where carfentanil is also coming from. And I feel like we need to answer those questions as well.
That's specifically actually what my husband does in his line of work. He's a physician. And so what we're trying to do in our community, for example, is to create those opportunities for people to, they're going to do it anyways. So the people that are currently experimenting and then becoming addicted to opioids, they're going to do it anyways, and a lot of times we've been turning a blind eye as a community to that, and I believe what we need to do is just accept that that's going to happen and create an environment that's safe, like safe injection sites, but not just a place where they can just go and inject, a place where they can go and receive the help and the counseling that they require. In order to do that, there's such a shame base associated with these addictions that I believe that we really need to be able to create an atmosphere of non-judgment, a place where they can feel safe to safely inject, and that sometimes, like they're doing in Vancouver in certain areas, is that we actually provide them with a drug that's safe, because with the carfentanil and all the other mixed opioids, if you will, out there, it's creating a huge burden not just to the patients and their families, but to our system as a whole in healthcare. So I think it's a huge question, and there's a huge answer that's associated with it, and it's certainly something that we can't do within isolation.
Until December 2018, you can have a say in how the federal government tackles opioid addiction. A public consultation is underway, looking for new ideas on tackling substance abuse. On our website, you will find a link to the government's online survey and a place to share your story. It's your turn to speak up. I'm Glenn McGuinness. Thanks for watching this episode of Outburst on the Cable Public Affairs channel. Next week, we'll be exploring Canada's relationship with our neighbor to the south, the United States of America. You can find us on social media or send us an email at outburst@cpac.ca. It's your turn to speak up, and we'd love to hear from you.